Welcome back, everyone. Well, Drug Take Back Day is happening this weekend here in the capital city. So basically, if you have any old prescriptions that are lying around the house, this is the chance that you have to go and dispose of them properly and hopefully avoid potential harm to others. There in your home, we've got Special Agent Scott Arsenault joining us this morning. Good morning to you.
Good morning.
Thank you so much for coming on today and helping us learn a little bit more about this event happening this weekend and the importance behind it. So first, just tell us a little bit about Drug Take Back Day and kind of the goal behind this event.
DEA started Drug Take Back Day back in 2010 as a way to take from the general public the unwanted prescription drugs they may have at their house and give them an avenue to have them destroyed properly. It has changed to become more of a way to affect the ongoing prescription addiction opioid crisis.
And so basically, if you were given a prescription, you're no longer taking it, but there's still some pills in that bottle laying around your house. What do you do with those? You can put them in the trash, and that just, people find those somehow. Or if you have them at home, you might continue taking them. So this is just a way to kind of avoid any potential harm and danger. You, of course, working with the DEA, do you see a need for this to really combat that and raise awareness about disposing properly?
Of course. In America, we have 4 million people addicted to painkillers. And a lot of those addictions lead to overdose deaths. There were 70,000 last year alone. Two-thirds of those, almost 50,000, were as a result of opioid usage. And what we see is those people who are addicted and or dying from this, they're getting the drugs from family and friends from the medicine cabinets. Mm-hmm. And what we're trying to do is give the public an avenue to take those drugs that aren't being used, that have been prescribed and years ago. We have people that have medicine in their cabinets from 10 years ago. And that is a potential source of supply for people to begin their addiction to start. So we want to give the public a chance to bring it to us. We'll destroy it properly and hopefully hit at home where the addictions are beginning.
Mm-hmm. And that, of course, a growing trend really across the nation. We've been hearing a lot about it, especially in recent years. So this is a great way to get ahead of that and really be part of the positive change with the opioid crisis. So there's going to be a number of drop-off locations. How's that work this weekend? Do they just bring them? Do they need to be in a bag? How does that work?
Well, nationwide there's about 6,000 drop-off locations. There's several in the Baton Rouge and surrounding parish areas. You can bring them as is. The only thing we're not taking is injectables, no syringes. It's kind of a danger issue. But bring them as is. You'll come, you'll dump them, give them to us, we'll put them in a bag. It'll be tied up, closed, never open again until it's destroyed. Totally anonymous. You don't have to give your name or anything. Just bring them and we'll take it.
And there's a number of drop-off locations here in the capital city and really all over Louisiana. What are some here? I think the police department is probably the most obvious one.
Yeah. First of all, if you want to find a location near you, you go to DEATakeback.com, okay, and you can put in your zip code and it'll tell you locations. Locally, we have them at several locations. We have a drop-off location at the Plaquemine Police Department. We have one at Walker Police Department, in Baker at their police department. And in Baton Rouge, we have one off of Burbank at the East Baton Rouge Sheriff's Office, Traffic Division of Burbank and the Gardere area. And then the biggest one in the area is at the Baton Rouge Police Department headquarters at 9000 Airline. And at that location, we've made it more than just a drop-off location. We've made it an outreach, a community outreach event. With our partners at Baton Rouge Police Department and Blue Cross Blue Shield has really helped us out. We are having community providers, addiction specialists, mental health specialists to be there to give education to people. So it is totally anonymous, but if you have questions, they have a lot of answers for you there.
And educating yourself on how you can be a positive part of this change is definitely a great choice there. Thank you so much for joining us. We'll have this information online for you later this morning.